Hi, my name is Lisa, and I am an aesthetic registered nurse at Glow Theory. And today we're going to be talking about all things Morpheus8. So, first, starting out, what is Morpheus8? Morpheus8 is a radiofrequency microneedling device that helps stimulate collagen and help with any sort of skin laxity and texture in the skin. It is super helpful for creating that nice lift and give that nice skin glow. So specifically talking about our device here at Glow Theory, we use the Optimus Max, which is the top of the line Morpheus8 device. What's different about the traditional Morpheus8 device is that it uses scale mode, which is a lot more comfortable for the patient and it requires fewer passes. Let's take a closer look at the Morpheus8 handpiece that we use here. So the Morpheus8 has 24 pins. Typically, we use the standard handpiece tip of the 24 pins, which are insulated needles that emit radio frequency into the skin at different depths. When we go into detail about other protocols, such as the advanced tip, which also has 24 pins, but it's going in the skin at a fixed depth of 0.5 millimeters into the skin. We also have the prime tip, which has 24 pins to treat those smaller areas on the face, such as around the eyes. The periorbital area can sometimes hold a lot of laxity, so we're able to go a lot closer to around the eyes to help assist with any sort of laxity in the skin. So it helps us get a little bit more specific about placement and help with those results even more. So first, let's talk about the specific standard protocol for Morpheus8 using the 24 pens and what that process would look like. So around different parts of the face, we're using different depths. I'm very particular about where we place any sort of contouring at higher depths in the skin. Typically on the forehead and cheek area, we don't want to go at too high of a depth to avoid any sort of fat loss in those areas. So who is a good candidate for Morpheus8? The great thing about Morpheus with the standard tip is that it's safe for all skin types 1 through 6. This is especially important for patients because we want to ensure that they get the best sort of treatment possible. So along with Morpheus being safe for all skin types, it's also safe for all ages. We see a wide range of patients here at Glow Theory from age 20 to age 70. It is a totally safe and effective treatment. Let's talk more specifically about the resurfacing tip. The resurfacing tip is great for treating any superficial acne texture or any texture in general, that is. And with the resurfacing tip, we are able to treat all skin types 1 through 6. With the higher Fitzpatrick skin types, we would want to get a pre-treatment on board prior to treatment, but it is absolutely safe for all skin types. And now talking about the prime tip with 12 pins, I would say anybody is an ideal candidate for the prime tip. However, we see great results from patients who have more skin laxity and who need more of that under eye and on the brow bone sort of lift. Let's walk through what a typical Morpheus8 appointment would look like. So we would first do a consultation before any sort of treatment. However, after the consultation, we will take some baseline photos because we want to see some improvement after our series of 3, of course. So we'd start by taking photos, and then after that, we would talk about any sort of questions or concerns. And then after that, we would apply the topical numbing agent of lidocaine. That will typically sit on the skin for about 45 minutes to an hour. And then after that, we wipe off all the numbing cream, and then it's time to get started with the treatment. The treatment itself looks like a little stamping motion. I typically like to start on the forehead and then work my way around the face, and then lastly, leaving the neck. So how long does the treatment take itself? The treatment itself takes about 30 to 35 minutes to perform a standard Morpheus8 treatment. With the advanced tips, we're able to probably complete the treatment in around 35 to 45 minutes. So after the treatment, what can you expect? So immediately after treatment, you're going to feel some warmth on the skin. Your face is also going to look a little bit red, like you just had a sunburn. That will typically last for the next 2 to 3 days. After the redness subsides, you're going to develop some grid-like texture on the skin, that's going to be a little bit darker than your skin tone. That will eventually dissipate in about a week. So what products are you using on your skin post-treatment? Typically, I like to recommend the Revision CMT cream. This is a fabulous post-procedure product. There's a lot of antioxidants in here, and in addition to peptides to help heal and hydrate the skin, keep it nice and hydrated. In addition to that, I have some patients that like to use the Elastin Skin Nectar to help keep the skin hydrated post-procedure. That will help speed up wound healing as well. Or some people want to go on the more simple route and use Aquaphor, which is a fabulous product to use post Morpheus8 treatment. So something I like to do for an added bonus post-treatment would be exosomes. Exosomes are a fabulous product because they are human-derived growth factor, which are going to help speed up wound healing, take down the heat on the skin immediately post-treatment, and then also enhance results as well. So typically we have you space out each treatment 4 to 6 weeks apart, and that's because we want you to build upon collagen and build collagen per session. And we don't want you to go longer than the 4 to 6 weeks because we don't want to go back a step. We want to keep that momentum going and keep building that collagen by that final treatment so we can see results 3 months after. So now, what are some common misconceptions about Morpheus8? One of the biggest concerns I hear from patients are, I don't want to lose fat in areas that I don't want to lose fat. And I totally hear what they're saying. I'd say the patient that comes in with that concern, I would say just make sure you do your research. You want to go to a provider that knows what they're doing and that they have the expertise to give you a good treatment to achieve the results that you want. At Glow Theory, we are very specific about where we place any sort of fat loss. We are very specific about where we do any sort of contouring and debulking. We want you to see results and not lose fat where you don't need to. Another big misconception I hear about Morpheus8 is that it's so painful. And I say that at Glow Theory, we have a lot of comfort measures on board that we can utilize. One of them being the topical numbing agent. We have a very strong topical numbing cream that helps assist with pain. In addition to that, we also have Pronox available too, which helps distract from the pain a little bit. It doesn't immediately take away the pain, but it definitely helps distract from it. In addition to that, we also have nerve blocks, which can be injected into the skin that can help numb a few areas around the face to help assist with any sort of pain. After the first treatment, with all these pain protocols on board, I have a lot of patients say that it's not as bad as they thought and they're ready for their next treatment. So lastly, one of the common misconceptions I hear from patients is, am I going to hyperpigment? And to that, I say it's important to have a good pre-treatment plan on board to mitigate any of those results from occurring. We want to ensure that our patients have the safest treatment possible. And I think pre-treating is very important. If you are a higher Fitzpatrick skin type, I genuinely love this treatment because I love seeing my patients achieve the results that they want. This is a treatment for helping the skin tighten, help reduce any sort of skin laxity, and then also helping with any sort of texture on the skin as well. So when they come in 90 days post that last session and they see how much their skin has improved, it makes my heart so happy. Thank you so much for watching this video. If you have any questions, feel free to put it in the comments below, and then don't forget to like and subscribe, and then we'll see you here at Glow Theory for a consultation.